I got involved in ONA like I think many people do. There seemed to be some unfair things happening in my workplace.
I started my career working in a non-unionized facility and ran into a couple employer-employee issues.
I'm an emerge nurse, and there was a number of inequities that we experienced that we thought were unique.
I was working at a hospital in Sudbury. Someone came up to me and said, "Would you sign this? We want to become part of the Ontario Nurses Association."
So I went to this annual meeting. I saw all these amazing nurses on the floor talking about political positions, talking about policy, talking about money. And I thought, if they're going to take my dues, I want to get more involved in the union and have a say.
When I became part of an ONA bargaining unit, I realized that things could be a whole lot better and that the safety and the respect and workplace environment was very much impacted by the strength of the union in the workplace.
If I think back over the some 40 years that I was involved in bargaining at local and provincial levels, we got maternity leave top-up, retiree benefits, the weekend worker, we got weekend premiums. We had the highest number of new members organized of any union in Canada.
One of the achievements, the inclusion of the professional responsibility clause. It gave nurses the opportunity to identify unsafe working conditions, workload issues. It helped nurses protect the public.
The 1990s started the layoffs of nurses. Hospital budgets were cut. They looked at the bottom line. They would take a nurse from cardiac care and put her in labor and delivery, treating them like widgets and moving them wherever they had a space, not recognizing the needs of the patients that they were looking after and recognizing that all nurses' skills were different. One of the things that highlights is the gender bias against nursing as a profession. Being female-dominated, we tend to get treated differently.
The SARS Commission took place in the fall of 2003 after there were no more cases of SARS that were known. And this Judge Archie Campbell did the review, and he was very supportive of nurses and felt that the frontline nurses had a strong voice and an effective voice and that they should have been listened to.
So a lot of the things that we learned through SARS about health and safety, protective equipment, were not embedded within the healthcare system enough for us to learn and go forward for future pandemics.
We won at the Supreme Court on some of this legislation, Bill 124, for instance. These are major pushes and major battles to win. That was all going on during the pandemic.
We have fought for 50 years, and we have improved the lives of nurses, and we aren't going to be stopping here. If it wasn't for ONA, our members would not have a voice at the tables they're at, and they wouldn't have a seat at the tables that we desperately need to be at with government and the employers to make our work life better.